Welcome back, everyone. Today we are talking with the experts from Intermountain Healthcare about sports injuries. Rachel Decker, a nurse practitioner from the TOSH Back and Neck Center, joins me now with some advice. How do you prevent a back injury? It seems like it can happen kind of out of nowhere.
Yes, back injuries can happen out of nowhere, and while there's no way to entirely prevent a back injury, there are certain things you can do to minimize your risk of getting a back injury.
Exercise is important, right? These muscles we have are meant to be used.
That's correct. Exercising for at least 30 minutes a day is very helpful to maintain your back health and just your overall well-being and health in general.
I thought it was interesting when I was kind of reading up and studying some notes, the amount of texting that people do and computer work is really contributing to a lot more back problems.
It absolutely is, especially with the neck. People are hunched over their computers, hunched over their smartphones for many hours a day, and I would recommend taking frequent breaks from that position to get up, move around, walk around, do some simple stretches to avoid chronic problems from that.
And what about stress? I know that was on there too. I mean, are there things we can do in just our day-to-day life to kind of eliminate some of the risk factors?
Absolutely. Stress puts a lot of pressure on our shoulders and in our neck. A lot of us hold our stress in our upper body, and doing relaxation exercises to try to calm those muscles is important. You can try guided imagery, yoga. There's all sorts of different modalities to try for that.
Okay, we do have people here on our phone banks answering any and all questions you might have. The number's there on your screen, 1-877-908-0860. One last question. If you do hurt your back, I just threw mine out in December. Okay. What do you do to get better and still kind of live your life?
Yeah, there's simple things that you can do on your own at home. Again, staying active. Don't rest too much, because that will just make the muscles tighter and weaker. So stay active. You can take simple over-the-counter pain medications, ice, heat, stretching. If the pain doesn't get any better within a few days, then we would recommend probably having it checked out. At TOSH, we have the Back and Neck Center, which we'd be happy to get you in a couple of days and evaluate your back pain.
Perfect. Rachel Decker, thank you so much for the information. Mark, no more excuses. We don't want to hear any more complaints about your aching back.
I do about 5